Hello everybody, my name is Ahmed Mirza, nurse practitioner. This is day in the life of a nurse practitioner in primary care and urgent care. Then this is one of the handiest tools in primary care and urgent care, an otoscope. And then in my jacket I keep my stethoscope, and we keep the otoscope in this pocket. We're ready to go. Let's go see some patients. Okay, so we just did a suture removal on a patient that had a laceration on his knee about 10 days ago, and he came in today for suture removal. Okay, we have a suture removal kit here. It comes with suture removal scissors, some forceps, a little bit of gauze. I usually use a little bit of iodine. I kind of clean the area. What's nice about these suture removal scissors is there's that little hook. You basically just hook it right underneath the suture, and then you snip it, and then you use these to pull them out. So you can see these are what stitches look like when they come out. Sometimes if it's a really tight suture and you can't get that scissor hook underneath it, if it's too tight, you can use a scalpel, and this is a little bit thinner and easier to get under the stitch. And you just nick the stitch a little bit and you can pull it out. And then we put usually some triple antibiotic ointment and cover it up with bandage. Tell them take it easy for another week so it doesn't open back up. If they notice it open up or get infected, they would come back and we would take a look at it again. All right, so we had a nice rush there. We got to see a lot of patients. Right now we're catching up on some lab results from yesterday. So you can see here some STI swabs, COVID, pregnancy tests, urines, a lot of blood work here, thyroid, complete blood count. I go through all of these, leave notes in the chart, see who needs to come back, or who we can do a virtual visit and discuss with. All right, so we've had a pretty busy morning so far. We've seen about 15 or so patients this morning so far, and one of the patients that we have now is a patient that came in, a male teenager in high school, had a sport-related injury at football, injured his thumb. He presented with swelling, pain, reduced range of motion of the thumb. So we're gonna go ahead and shoot an x-ray. Let's go see the x-ray room. So here is our digital x-ray room. As you can see, there's a table here. We have it set up for the hand x-ray. Okay, and sometimes if you need a chest x-ray, you can use this for standing up x-rays. A lot of times with chest x-rays or other kind of stand-up x-rays, back x-rays, abdominal x-rays, you can use that. If they need to lay down, they can lay down here. For the hand, we'll do the hand x-ray here. So typically when you do a hand x-ray, we get an AP view, which is flat down. You get an oblique view, so you put this block here, get a tilted view, an oblique view, and then you want to get a lateral view. So you want to get it just like this, so you get a third view of the x-ray like that. And that'll give you a good idea of if there's a fracture or not. Nice thing about the x-ray here is it's a digital x-ray. We can take a look at the x-ray reading ourselves and do the initial interpretation of the x-ray and see if there's a fracture. Because if there is a fracture, then we have to go ahead and take care of that, splint it for the patient, and then refer them out to orthopedic surgery. This is where the patient was having the pain, and you can see it's hard to tell. You can zoom in. So this area right here, this is the area of concerning for a fracture. It's not aligned properly, and you can see here in this view as well, this irregularity here, irregularity over here, more concerning for a fracture. Here is another view of the thumb, and you can see that this bone is completely misaligned. It's called a displacement. It should be straight on this bone here, but you can see it has shifted here. And this is where the broken bone is for the thumb. So he has a displaced thumb fracture. So since he has a displaced thumb fracture, we can't just leave it alone. We have to splint it for the patient to prevent it from injuring it more or moving and getting worse. These are the fiberglass splints that we use. So you have a 2-inch, 3-inch, and a 4-inch. And this it gets hard, it hardens up like a cast. Anytime you do a splint with an acute fracture, you don't want to do a full cast right away because you need room to allow the fracture and the tissue to swell. And you don't want to trap it in there. So we do, it's kind of like a half cast, half hard, half soft to allow it to swell. And then when they follow up with the orthopedics doctor, they usually take them out, either put them in some kind of brace or some kind of cast. So you measure out the fiberglass that you need. You use a stockinette to wrap the arm in, and you use some padding so you can make it nice and comfortable. And then this is a nice guide here, and then it'll look like this. So for this patient, we did a thumb spica splint, and that's what it ended up looking like. So this part right here, the dark part, is where it's hard, where the fiberglass is, and the rest of it is padding and wrap. Because of this displaced fracture, the patient will have to see an orthopedic hand specialist and determine whether or not he will need pinning done to hold that bone back into place so it can heal in the right position. In between patients, the key is to try to get as much charting done, try to get your notes done for the patients in between as much as you can, so you don't have so much work to do after your shift is done or when you get home or for the next day. You also need to send the medications right away so the patients have those as soon as they get to the pharmacy. Nowadays, everything is done electronically, so no paper prescriptions, but you go into your electronic medical health record and go ahead and send the medication. So if it's a pediatric patient, it takes a little bit longer because you need to calculate the dose based on the weight. And now it's time to do some charts to check on some old labs from yesterday and make sure we are caught up with everything while we have a little bit of downtime in between patients. Other things that we offer here in our practice are EKGs, so we have to be good at reading EKGs. Patients that need help with the medical weight loss, we do offer that as well. The full gamut of family practice, from kids all the way up to elderly. We do all of urgent care as well. So it's a very exciting and fun place to work. The day always passes by quickly as the patients kind of come in. Sometimes it can be a little bit stressful because in medicine it seems like everything comes in waves. So you have some downtime and all of a sudden you have everybody that comes in at once. So you just got to take it one patient at a time, make sure you're doing everything safe and you're giving everybody their individual attention when you're taking care of that patient. I would say the biggest thing that I struggle with, and probably a lot of people in medicine that struggle with, is keeping up with the notes. The notes take a little bit of time, so you got to make sure you document everything properly, make sure all the labs were sent in order, make sure all the medications were sent, make sure your note is done, why the patient came in there, their physical assessment, and the plan. If you can imagine, if you saw 30 patients in a day, 35, 40, then each note, let's say it takes you 10 minutes, it takes some time. If you get behind in your notes, then you're stuck at the end of your day or home on your day off finishing your notes. So there you have it, just a short day in the life as a nurse practitioner working in primary care and urgent care. Stay tuned for the next one. Thank you.